Osteoarthritis is a disease that affects mostly the knee joint. Of course, it can affect all other joints, but largely affects the knee joint. It is a degenerative condition which leads to the cartilage gradually degenerating over time, eventually to a point where the knee needs a complete replacement. Now, while we have ways to sort of treat a patient initially in the initial stages of the disease using painkillers or non-steroidal anti-inflammatory drugs, and eventually of course get the knee replaced using a artificially developed knee replacement device, unfortunately we have nothing that actually treats the underlying disease. The treatment strategies to treat the underlying disease right now, they are referred to as the development of disease-modifying osteoarthritic drugs. While there are multiple groups in the world that are trying to develop these disease-modifying osteoarthritic drugs, we haven't had too many successes. A few of them probably reached stage 2 and stage 3 and have failed. What we have done in this work is tried to develop something that is natively available. The natively available molecule is referred to as tissue inhibitor of matrix proteases, which is TIMP, and the number 3 associated with it, which is in short Timp3. Now, Timp3 is a molecule which is available. It disallows the degeneration of cartilage. However, it has a very short transient half-life, and therefore its availability, its bioavailability at the local tissue is very, very short-lived and does not allow its function to be executed. So all we did in this paper was allow Timp3 to have a longer half-life by associating it with an artificially developed sulfated glucosaminoGlycan molecule. So we used a glucosaminoGlycan mimic, in this case carboxymethylcellulose, which is a mimic, and we modified it to have sulfation in it. Then the sulfation is responsible for immobilizing the Timp3 molecule onto it. And because Timp3 is now immobilized on artificially developed glucosaminoGlycan that is sulfated, it now has a far longer half-life than it used to have when it is naturally available. Now, in the osteoarthritic condition where it is degrading all the types of proteins that are available in the environment, because of the association with the sulfated CMC or carboxymethylcellulose, it sort of has the ability to be not degraded and at the same time function reasonably well, and therefore gradually over a period of time disallowing the degeneration of cartilage, and as a consequence providing a reasonably good treatment strategy to patients suffering from osteoarthritis. We believe that this strategy, if it can be translated, therefore we thought that we should transform this sulfated GAG mimicking molecule into a full-blown scaffold. So we developed a three-dimensional matrix on which the Timp3 could be immobilized, and this three-dimensional matrix we demonstrated in a goat cartilage explant model for osteoarthritis that it is working fine. And then to further give a better proof of principle, we used human cartilage explants, and these human diseased cartilage explants we did the same treatment strategy, and interestingly it worked even in the human cartilage explant, thereby seemingly providing enough evidence that this is a potential strategy for the treatment of osteoarthritis.